Services Committee of the Marathon County Board of Supervisors to order. We will begin with the public comment section. Nobody has contacted me in advance about possible public comments, but is there anybody from the public that would like to make a comment here today? All right, we will move on. Thank you. We do have a quorum, so we will continue with the approval on item 3, approval of the February 2nd Health and Human Services Committee meeting, and also the February 22nd, 2022 special meeting minutes were included in the packet. We'll take the first one, the February 2nd meeting. Are there any additions or corrections to those meeting minutes? Seeing none, motion to approve would be in order. Supervisor Van Cray with the motion. Do I have a second? Would anybody care to second approving the minutes from February 2nd?
Kelly Gage.
Supervisor Gonring, I second the motion.
All right. I got Kelly first. I'll go with that. Any further discussion? Seeing none, all in favor say aye. Aye. Opposed?
Aye.
That motion is carried. Thank you. All right, now for the February 22nd special meeting packet. Any additions or corrections to that? If none, a motion to approve would be in order. Supervisor Gonring, could I have you on that one? We have a big delay here today, I think.
I'll second again.
Okay, sounds good. Any further discussion? Seeing none, all in favor say aye. Aye.
Aye. Aye.
Opposed? That motion is carried. Thank you. All right, item 4, policy issues, discussion, and potential committee determination. We do not have anything in that category today, nor in the operational functions required by statute, ordinance, or resolution. However, item 6, educational presentations and committee discussion. 6A is a memorandum of understanding between Marathon County, Nchc, and the Wausau Area Transit System for specialized transportation assistance. And we have Dave Mack with us here today to explain that memorandum and the process there. Dave, are you on?
I am. Thank you. Thanks for having me today. So today I have in your packet for you the Memorandum of Understanding that the chairman just mentioned. I bring this to you today for your review, but not necessarily to take action on. This is a document that we produce annually, and it really stems from the work that the Transportation Coordinating Committee and then you as the Health and Human Services Committee does in the fall of the year when we produce the grant application for what we call the 8521 Specialized Transportation Program, or the 8521 Elderly and Disabled Transportation Program. If you recall, back in November, we approved that that application document that goes to the Department of Transportation to get state funds from a grant that they have in order for us to provide rides for the elderly and disabled. And so once we go through that process, we then get an agreement with the state of Wisconsin. They have subsequently submitted that agreement to us. We've taken care of that agreement with them. And what we do on an annual basis then is provide that agreement back to our two recipients, or our partners in providing the rides for the system, that being North Central Healthcare and Metro Ride from Wausau Area Transit. And so what you see before you in this memorandum that we have between the three entities is really almost a mirror copy of what we have for the state agreement with the county. The county receives funds, and then we pass it on to our two partners to provide the rides for the service. So I was just going to walk through this agreement real quickly with you so that you may have a chance to see it. I don't know that we normally bring this to the Health and Human Services Committee. Typically, this is approved by Administrator Leonard as an administrative function for the county, so it does not go back through the committee structure. But I just thought that it would be important for you to maybe see this because we haven't done this before. Give you a chance to see what the follow-up is to the work that you do in the fall for the county. In the document itself, I just want to highlight a couple of things. There is some in the first page some statutory language that gives us the authority to do all of this. It does say that this is only good for the calendar year of 2022. And then probably the most important part for the two entities that we work with is the funding component, which is in section 2 of the document. It identifies that we are receiving $361,700 from the state as the grant to us. We must match that with a 20% match of $72,300. So the total program cost or the funds that we have available to spend is $434,000. From that, we distribute the monies 3 ways. We give North Central Healthcare about $260,000 of that state match, the state grant, and we then provide the 20% match for that. The Metro Ride gets about $72,300 for their component of service within the city of Wausau, and the city of Wausau pays that local match of $14,400. And then we at the CPC office utilize about $28,900 of those funds to administer the program. That also entails creating the grant application that we do every year, and also to staff the Transportation Coordinating Committee that is a part of this process. They are by statute, they need to be created at the county and to oversee the operation of or the usage of those funds that we receive from the state. Just below those numbers, we have a couple paragraphs that talk about quarterly reporting. I am going to be removing that section from the contract or the MOU when it's finalized. This information is identified later on in section 9, a little bit more detailed. So we're going to remove this piece. Section 3 really goes through some of the responsibilities, and those are most of the responsibilities or the items that we talk about what we're going to do in providing our service is laid out in that grant application that we produce in the fall of the year every year. It does identify that we have to make the local match. And there's a lot of legal language in here as well. One of the things that we do have the ability to do as part of this whole program is that if we do not spend all of the funds that are administered to us from the state would like us to keep those funds, even though we're not using them for the program in that year. And they have given us the ability to put those funds into a trust fund. And it's identified under section 6 in the document, the ability to create this trust fund. And we then have the ability to go back and utilize the funds that are in that trust fund to use that for capital expenses if we need to. And at this particular time, we are in a position where we have money in that fund. And we have more money in the fund than the state would like us to have. So we're in the process right now of identifying things that we need to be looking at purchasing. In the application that we produced last fall, we had identified that we will be purchasing 7 new bus shelters that are going to be on the Metro Ride bus routes. These shelters are not ADA compliant anymore. I don't think they ever will. They ever were. So we're going to purchase some new ones and make them ADA compliant. And then And so they're scattered throughout the community where the Metro Ride paratransit service picks up people at those locations. So we're going to use some funds to pay for some new shelters. I think that's in the neighborhood of about $45,000. We're also looking to purchase another handicap, a lift-equipped van for North Central Healthcare to provide rides for individuals throughout the county. And then we're also in the middle of a new planning process where we're doing another elderly and disabled transportation needs assessment for the county. We've contracted with North Central Wisconsin Regional Planning Commission, and they will be producing this needs assessment. So you will probably hear some things about that throughout the course of the rest of the year. We should be done with that by the end of the year, but we are paying them with a federal transportation or a federal transit grant that we got, and we have to create a local match for that, and we're using about $6,000 of this trust to pay for that study. So the state has identified to us that they would rather see us keep those funds in the trust and use them for different things that we have available to us than to give the money back to the state. So we have that money available. So the hopes is that we're bringing that trust fund amount down by purchasing some needed equipment that we have throughout the area. Going through the document a little bit more, there's a lot of some of the legal information that we have about how we record things and auditing that we need to do to take place for the grant. The reporting requirements are in section 9. Just on a quarterly basis, we need to be providing information back to the Department of Transportation for the use of our funds and how many rides and how much money we're spending, so that we're tracking that. And the Transportation Coordinating Committee oversees that, and they monitor those reports before we send them to the state. After that, really looking at a lot of the legal language again, and I'm scrolling through the document as I speak, and it really gets to the end where the three entities, we have the chief officials from those three groups: North Central Healthcare, the City of Wausau, the mayor signs that, and our administrator Leonard signs ours for the county to go into this agreement. Mr. Chair, that was a pretty quick overview of this document. So I'd be willing to take any comments or questions if you'd like. And after this, we will be asking Mr. Leonard to sign the document, and we'll pass it on to the other two entities to go into this agreement with us.
All right. Sounds good, Dave. Thank you. Any questions or comments from committee members? Supervisor Krause.
Thank you, Chair Boutke. Yes, I've looked over quite a few of the different transportation committees, which there are quite a number. And the information is extensive and very detailed. And I've been trying to wrap my head around it, but just before I got here, I spent like 3 hours just going over some of the information, and it's probably not even 10% of what is there. I would like to know, in your position, what is the most difficult task that you have to accomplish to get this work done? And then I would also like to know what is the easiest for you.
I'm assuming you're asking me that question.
Yes, I believe so,
Yes.
Dave.
Is that correct? Okay. Interesting. My role has been for the last 25 years or so now, the county's transportation planner. And as part of those duties, I take on this role of administering the elderly and disabled transportation program for the county, doing the grant application and then the reporting of it, and making sure that the two recipients of the funds are performing the jobs that they're supposed to be doing as part of that program. I'm also a part of, as part of the county, we also staff a group called the Metropolitan Planning Organization, and that group is made up of all the chief elected officials in the metro area, and we receive federal and state funds to do road project. We do the planning portion of some of the road projects that are done within the metro area. And so it's a function of my duties as being county staff, but it's really a larger group or a larger entity than just me doing something for the county. The tasks that are established to oversee the Transportation Coordinating Committee and provide for the elderly and disabled program it's not necessarily a difficult program, but it's one that you have to have input into what's happening on a monthly basis. And then when you get to the fall, it becomes more involved with creating the application and making sure that it goes through the committee structure properly, because all of those things are scripted in state statute. Even the membership of the committee is identified in the statute as to who should be included in that committee. So I do take that portion of my job duties quite seriously. I know that the rides that we provide for people within the county are extremely important to them. Some of them only have this service as a means to have transportation within the community. And so it's vital to some of our most vulnerable populations that we have these services for them. So I would say that it's a large task that I perform in making sure that this is part of it. As part of that Metropolitan group that I mentioned, I also have the responsibility to help provide the planning for the transit system within the city of Wausau. We're currently undertaking a transit study right now that we hope to be completed by the end of the summer, early fall of this year. It's a 5-year look at what we should be doing from a transportation perspective for the city of Wausau's Metro ride system, and to see if there's any other transportation things that we can add to or maybe expand into other communities within the metro area. So that's another component that I'm working on right now. That is a very large component of my time. So I don't know that I can actually answer the question of what's the most difficult tasks and the most maybe my easiest tasks, but I have a number of those tasks that I perform for the county in the transportation world, as well as managing the planning program for the county, for the county CPZ office, managing the GIS program, the surveyors, and the planners within the county as well. So wear a couple of hats actually for the county. But if you want me to answer anything more specific about my duties, I could be more specific if you'd like.
I think that's adequate, Dave. I'd probably want to direct committee members to specifically deal with the memorandum that's on the table before you today as far as what the discussion point is here, but appreciate your input on that. So further discussion from committee members. All right, Supervisor Krause.
Thank you, Chair Bootke. What I was wondering is, I see a lot of information from the state, but there's also USC codes, and all of this is written down. I was wondering if you are in any personal contact or with meetings with the federal transportation system.
From my perspective, if I may, Mr. Chair, we are in contact with both the Federal Transit Administration, regional office, and the Federal Highway Administration statewide office. That each state has an office of Federal Highway, and most everything that we do when it comes to the planning processes is by the Transit Administration, along with the partner of the, the Department of Transportation. Most of the work that we do is kind of conduit through the DOT from the federal agencies. But a lot of the work that we do needs to be seen and approved by the federal agencies. There are most of the funding that comes to us, and even in the 8521 program, some of that monies, I think, comes from the federal program to the state, and then it's distributed from the state down to the counties. And so there is an element of federal involvement, correct? Definitely.
Okay,
Thank you.
very good. Other questions from committee members about the memorandum? All right. I think, Dave, you explained it well. I think it makes sense. So hopefully everything will go into place. So I think we're good to go.
Thank you.
Yep. We will move on then. The next meeting time, location, announcements, and agenda items. 7A, committee members are asked to bring ideas for future discussion. So that would be at our next meeting, which would be for April 6, 2022, at 4 o'clock here at the Courthouse Assembly Room. So anything else that come before us for the go to the order today? If not, a motion to adjourn would be in order.
Harris with the first motion to adjourn.
Okay, that's Supervisor
Second,
Harris.
Kelly Gaber.
I have Supervisor Van Craig actually on the second already. So all in favor signify by saying aye. Aye.
Aye.
Opposed? That motion is carried. Thank you and have a good afternoon.